This is a Founding Media podcast.
Hey guys, welcome to Apple a Day Doc Talk. I'm here again with Eric Finger, physical therapist. Hey Eric.
Hey.
We're gonna be talking about lower cross syndrome today. This is actually part 2 of a 3-part series that we're talking about postural abnormalities with the help of our physical therapist here. Eric is actually an entrepreneur and started a company called Move Empower Concierge PT. He's a mobile physical therapist, so he'll go to your house, he'll go to your business, wherever you want to go, right?
Yeah. No longer do you need to sit in traffic in Mopac. I'll come to you.
Right. Eric's going to do the hard part and drive through Austin traffic for you, right? Okay. And then Eric, why did you become a PT? What got you into it?
Wow. Yeah. I was an athlete, as a youth, and knew I wanted to kind of continue that, and always had an interest in medicine, and kind of I saw that physical therapy was a way to kind of combine those two.
Yeah.
Injured my knee in college, had to go through physical therapy and surgery.
How'd you injure your knee? What happened?
I was just playing some pickup basketball.
Oh,
no one touched me and
Oh,
tore a ligament. Yeah, no fun. But so went through that myself and kind of really solidified that, this is the choice for me and such. And
great.
Went through and got her done.
Eric is a Midwesterner, began his formal education at the University of Kansas. How'd you like Kansas?
I like it.
Yeah.
Well, during basketball season, I prefer it.
Actually, he likes basketball, but he was a varsity swim. He was on the varsity swim team, right?
Yep.
And how was that? How'd you do there?
It did all right. Yeah, I was a butterflyer up there, and I remember coming to college swimming, and from high school, it was just night and day. I was like, oh, we're going to train that long in that many hours? Okay. So, no, it was great. It was best shape of my life, and met some great folks. So it was a good time.
Perfect. And then when he was there, he earned his Bachelor of Science in Exercise Science, and then completed graduate training at Texas Tech University Health Sciences Center in 2002. Then you graduated, and then you went on to this pretty extensive postgraduate training. Huh?
Yeah.
Tell me a little bit about what you...
Yeah, so, I got in, about 4 years into the career, I was kind of like, I need something here. I need to change it. So I went back and studied, and with physical therapy, you can sit for board exams. It's essentially just an exam to kind of show competence and such. And so I did that, and it was great. It really helped kind of refine my skills, and then again was needing something else, and went back and did some specialty training in manual therapy. And
right, and some of that training, you got your certification, and the APTA became a board-certified orthopedic specialist, and then a fellow of the American Academy of Orthopedic Manual Physical Therapy. And I thought that was really neat, because less than 10% of physical therapists in the country.
Yeah, exactly.
Have this.
It's kind of a nice distinction that kind of separates you from the herd and such. And not that I'm doing it for a bunch of letters after my name.
Right.
It's just it's a nice way to build a good skill set that helps me out. To treat everyone that comes through I treat, that I come in contact with.
What kind of insights do you think that that certification equipped you with, the American Academy of Orthopedic Manual Physical Therapy?
Yeah. So manual therapy, it obviously deals with the hands and such. We had training in thrust techniques, so maybe what you would see like a chiropractor doing. So we're manipulating joints. We're doing a lot of soft tissue work, meaning so we're doing some massage work. We're doing building a good knowledge of how joints work, how muscles, how they affect the joints. It just gave me a really good broad scope to be able to work with a lot of different people, because if there's one thing I've learned in my practice is that not one patient is the same. So having a lot of tools in the toolbox is great. So
that's great. And just a couple other hobbies. You compete in triathlons.
Yeah.
Is that right? And then your favorites, Escape from Alcatraz and Ironman cool. 70.3.
Yeah, I've done one half Iron, and then the Escape from Alcatraz a couple years back, which was pretty fun. Yeah, out in San Francisco. Yeah.
And you got 3 kids. And man, how do your kids like you traveling around town doing physical therapy?
Yeah, they're enjoying it. So my oldest is trying to help me with my social media.
Oh,
so,
really?
Yeah, I've never had a 12-year-old. I guess I'll have to start paying.
Very helpful.
Now.
Yes.
So it's great.
All right. So let's talk a little bit about lower cross syndrome. Eric, if you can tell us a little bit about what is it? What exactly is it?
So lower cross syndrome is kind of a situation where the hips, the pelvis, and the low back kind of adopt this dysfunctional posture. What you get is a kind of an asymmetry or an imbalance of the muscles in the front of those joints of the, the lower trunk and in the back or the rear. Yeah. So those set you up for kind of presenting with a posture that can be over time kind of hard on the body.
Yeah, and when you have that, the pelvis kind of tilts forward a little bit, doesn't it?
Exactly. So that kind of looks like, that's exactly right, where you'll get a kind of an increased curve in the low back. It leads to issues up and as you go up in the spine into the mid back, kind of a increased curvature there, and even a protruding, sometimes even kind of the head protruding too. So not only does it affect things locally down at the trunk, but it can affect things all the way up and down the chain, to be honest.
And I'm really glad we're talking about this too, because again, Eric and I, we work out together sometimes and go to the pretty big gyms and see this very, very frequently. And when the pelvis is tilt forward like that, like you said, you kind of have to shift your shoulders back so you can stand up straight. And this creates a huge lumbar curvature, basically a big curve in the spine. And why is that bad?
That's a great question. So when we increase, let's start there. Folks need to know that a natural curve down there is what's called a lordotic curve is good. We want that. That's healthy. The spine has about 3 different curves. But they're only supposed to be so much of each. And when you go too much or have a hyper curve down in that low back, it puts increased compression on the sensitive parts of the spine. So not just the joints, the bony parts, but even the ligaments and even the discs, which are the kind of the gel-like supportive pieces between each of the spine bones. You start doing that over time and add maybe load or activities, bad mechanics with sports or with lifting, you can start having issues.
Excellent. And when you say adding load, you mean above that curvature, pushing down onto it, where now all the pressure is being basically held right there in the overextension of that lumbar lower
It's becoming kind of the path of least resistance of the body. And the body's very smart, and it's going to find that, and that part of the body, that low back, is going to take the brunt of it. And you do that enough, you start kind of wearing out or kind of overdoing on those sensitive structures that we just talked about.
Right.
Yeah.
And this is why I wanted to stress this point, is because again, my top priority is safety, and I just want our audience to be aware of this postural abnormality in particular, because doing these types of exercise, trying to get, gains by lifting or pushing loads straight over your head when you have this big lumbar, basically increased extension at the lumbar curvature, that can be dangerous.
Yeah. It can be, I think, over time, deleterious to those structures and such. What you notice with this is that the muscles that tend to become tight are those lower back extensor muscles. Extensor, think of the kind of the long band-like muscles that you kind of see in the mirror. Those become pretty darn tight. The muscles in front of the body, the what we call the hip flexors, you've probably heard of psoas, that's pretty common, become ultimately tight. And then those are imbalanced by weakness in the lower abdominals, and one of the most important muscles in the body for me is the gluteus, the glutes. So it's that imbalance that just sets folks up.
And it's a really underworked area, the glutes. You see a couple of things that make me cringe a little bit when I'm in the gym and I see people moving in certain ways is something as basic as just getting to the gym, starting out and doing hamstring stretches. So when you have an AP tilt or lower cross syndrome, why can that be bad?
Doing with the hamstring stretches and such. Right. So if the hamstrings can develop tightness through there, but there's putting those hamstrings on stretch might alleviate some of the tightness that you're feeling, but you're not getting to the crux of the issue. Right.
And so there's the AP tilt. Your pelvis is tilted forward, basically pulling on that hamstring at the back of your leg.
Right.
And so it feels tight, not because it's actually tight, but because it's being pulled tight with the rotation.
With the rotation.
And then now you're stretching them out even more, making the AP tilt worse, making your problem worse. So something as simple, as and seemingly benign as a hamstring stretch can make things worse. So that's why we want you to kind of look in the mirror, see your, first and foremost, see your doctor. But if you do think, that, hey, maybe this looks a little bit like I have a pretty big curve, in my lumbar spine, or my pelvis is tilted forward, that I should probably go check this out and try to strengthen, like you said, your core, your lower abs, your gluteus maximus, and try to straighten that pelvis back out. And then another thing I tend to see, in the gym is people going from the hamstring stretch, they might go to the leg press machine. And that doesn't really have a lot of glute engagement. And so,
I think... there's so many exercises you can go out there, but I think trying to get the best exercise, the best exercise, the exercise to get the most bang for your buck is important. But I'm going to take a step back and even think, how did we get there in the first place? And we talked about the tightness, we talked about the postural abnormalities, but why did this weakness suddenly appear? And I think what folks need to know is that as the body's pretty darn smart. It has this tendency that when you have muscles that get tight on one side, its antagonist or the opposite guy tends to shut off, if you will, kind of goes on vacation.
Give us an example of agonist and antagonist.
Sure. So a pretty simple one would be the agonist, the biceps, antagonist, the triceps, go in the opposite direction. So, I hope that makes sense for folks. With the lower cross syndrome, the agonist would be maybe those hip flexors that get real tight, and then its antagonist, or the opposite, is that gluteus, or the glute max and such.
Right, and the hip flexors are basically bringing your knees up towards your chest, right?
You got it. Okay. Yep, bring your knees to your chest. And the glutes are extend the hips, so they help propel you. They're very key with one-legged stance or walking, going up and down stairs and such.
So there's an imbalance in terms of tightness and shortening on the front, the flexor movement, bringing your knees to your chest, versus kicking your leg backwards.
Right, and having that strength there. Yeah. I think folks might be wondering, well, how do I get this? Why do those glutes shut off? And someone. I'm trying to think who it was who coined the term, but gluteal amnesia is an issue. And what that's coming from is the glutes shut down, but a lot of it's from extended periods of sitting, believe it or not. That the glutes, when we're doing, I saw a stat the other day that the average American's sitting for over 7 hours a day, be it at work or in traffic. That can lead to those muscles shutting down, and this imbalance that we're discussing kind of take over. So when I see folks, going back to your question, I digress. Going back to your question about what's the exercise, I think we got to get back to, instead of going to the hip to the doing some big power squat. If those muscles aren't even turned on, let's say those glutes aren't even there, they're probably not going to participate. They should in a normal healthy body, but they're not. They're going to let the other guys who are dominating, beating the quads, maybe the hamstrings, and you're not going to turn them on. So I think the important part is maybe taking a step back and really, maybe just starting an exercise, laying down on your yoga mat, doing like what I call a bridge, where you're on your back with your knees bent, lifting your pelvis up, holding it and down, to turn that muscle on. And then, once it's turned on, quote unquote, then go over and begin those kind of bigger exercises. You're going to get more bang for your buck.
Right, and that's a really great exercise, Eric, especially if you're just trying to just isolate the glutes, laying on a yoga mat on your back, and then pushing through your heels down into the floor to squeeze your buttock, and not using the whole base of your foot or your toes and swinging up, from the yoga mat. It's got to be a slow, deliberative process where you squeeze the buttock, the glutes, and you got to think of the force going through your heels, so you can just isolate those muscles.
Exactly. Connect brain with muscle on that, and you'll the
myoneural connection, exactly.
Yes. So like you had said, think about pushing from the right area with the heels, and then also thinking, okay, I want my butt to do this job, and squeeze it as you lift up, right? And you will activate where you need to. So
excellent.
How can we overcomplicate such an easy exercise? But
it's the body smart, and it's going to go from point A to point B in the easiest way possible, right? And if, like you said, that muscle's been turned off and it has to do all this work to re-engage it, why do it? Why not just swing your way up there? One of the other reasons why we don't want you swinging up like that is because you can hurt yourself. Whenever you're using momentum in an exercise, you have to stop at just the right place. Or if you go a little too far, you're going to put too much of a curve in your back and hurt yourself.
I think momentum's, when I'm working with patients, I think that if any time I'm going to catch them on something is using momentum. I say, hey, you're cheating there. Let's slow it down. Because you're not only could you injure yourself, but also you're not recruiting the muscle as well. You're letting maybe gravity help out here, or
you start recruiting other muscles.
So.
And then when you go slowly, you kind of go up, get that squeeze and release slowly. You're getting the most out of that eccentric contraction. So what's the eccentric contraction?
So scientific. So I'll think of it, let's go to the bicep curl, right? We're holding that dumbbell in our hand. We're going to bring it up. As you bring it up, that's concentric. Now when we
the shortening of the muscle,
the shortening. Thanks. And then when you bring it back out to the starting position, that's the eccentric or lengthening
while under tension. So you've got that resistance, the cable, the barbell, the dumbbell, whatever it is, and you're flexed. You're trying to flex your bicep, but it's being lengthened. You're basically letting go, but you want to have control. Slow control over that whole phase. You don't want to just drop it, use momentum, and then lose that whole half of the contraction phase.
It's a great way to strengthen, by the way, too. So you're missing out.
And then one other exercise I noticed, not really an exercise, but movements in the gym that you'd want to avoid if you were to have this is, like you said, those flexor movements. Maybe something as simple as sit-ups, doing ab curls. You don't necessarily want to engage that iliopsoas complex, which flexes your hip, brings your knee up to your chest, because that's going to pull your pelvis. It's going to make the postural abnormality more pronounced. It's actually going to pull it down more.
Agreed. I think until you have that tightness alleviated, once you get the proper length, then I think you can go back to some of those exercises. But I think you're just feeding into that overactivity if you're doing exercises like you mentioned, or even I was thinking just what are they called? The Roman chair, where you're doing, where you're bringing the knees
to do ab work,
and such might not be the best one to do at that time, or with if you're dealing with this.
So basically, what Eric is saying is that you're basically suspending yourself in the air with your hands and pulling your knees up to your chest, trying to flex your core and build your abs. But when you bring your knees up, it's not all ab work. You likely are engaging your flexors. And so you want to try to avoid anything like that that's going to make your problem worse. You want to try to work the other side, like the glutes. And how would you work the core, the abs, rectus abdominis complex, without engaging too much flexor movement? How would you do that?
Sure. So the abdominals that I tend to try to turn on here, I start again. I'm going to go way back to basics. I'm going to have someone down on the mat with their knees bent, and we're going to work on really trying to just activate the deepest of the core muscles, what I call the transverse abdominis. Think of it as a kind of a muscle that kind of envelops your lower trunk, kind of like where a cummerbund would sit on someone. Okay, and we're going to start there, believe it or not. And I'm going to spend 10 minutes there, really educating folks on how to turn that on, because we're going to incorporate that in with other exercises. If we can get that muscle turned on, we're going to have better. Why is that so important? Let me take a step back. Is because it has intimate connection with the spine. It's a stabilizer of the spine, increases the intra-abdominal pressure and gives it some sturdiness. So once we get that turned on, you're not going to have that curve, that we're worried about with the lower cross syndrome, and we can really turn that muscle on, and then take it to other exercises. So starting on the mat, I particularly like to do just a marching exercise, believe it or not, lying on your back to engage the lower abdominals, but by activating that transverse abdominis up front first. So
you really have to think about the engagement when you're doing your core, right? I know people say all of that, engage your abs, but you have to learn the difference. And we keep saying the term myoneural connection, but there is a muscle nerve link that you want to establish and learn what the difference is. Like when you're talking about trans versus abdominis, you want to learn what it feels like to flex that so that you don't mistakenly think that you're doing ab work when you're doing hip flexor work.
Yeah, exactly. No, it's you nailed it right there. I'll even, to kind of highlight that, I'll even bring myself over when I'm doing a plank and be by a mirror just to make sure that my rump isn't too high or I'm arching, kind of playing it out like what maybe someone with lower cross syndrome might look like. You probably folks have probably seen someone with the plank and their low back has a, kind of
really
nice curvature.
Curve,
you can put a cup of water to sit there on it. So
excellent. And some of the injuries you get or tend to see in patients with lower cross syndrome would be, what do you?
Sure. With the spine, we already talked about how that kind of sets the spine up in a kind of compressive. So it's already, the spine's already under a little stress, kind of closed down. Add to that maybe a powerful golf swing, weakness of the lower abdominals. You can see some sprains of the low back. You can
low
really
back pain is a huge
back
problem.
Pain, yeah.
And then
the first one I think of.
We mentioned the hamstring complex strain just because of that pulling that's going on in the hamstring behind the leg because of that AP tilt, anterior pelvic tilt.
Exactly.
And then you can also get some anterior knee pain with this pain in the front of the knee.
Sure.
Just because of the malalignment of your
the tightness.
pelvis.
Not only is the hip flexor, that psoas muscle tight, but one of the quads, particularly the rectus, it's a big muscle. One of your longest muscles in the quadriceps that connects to your kneecap to your pelvis is too tight. Well, it connects to the kneecap, so you're going to have some abnormal pull down there, and it can aggravate even the knee and such. So, it's not just localized to the trunk for sure.
Okay. And you mentioned sitting being a really big problem. It's a big part of a lot of people's day. Are there anything else, any other activities or movement patterns that can promote this or help, make this happen?
I think activities that where you're in positions of extension too much. So extension, maybe someone who stands, stands for long periods, works on concrete or something like that, can kind of develop if they don't have that hip strength. That can be an issue. From an exercise, someone at the gym who might be doing exercises maybe that promote hyperextension and such. That would be something that could maybe promote this if they're not balancing themselves on the opposite side.
Just out of curiosity for me, Eric, how big of a part of your practice would you say that lower cross syndrome is?
I think the spine in general, anything that is attached to the spine is probably going to be, typically probably about 60 to 70% of what I see. Okay. Yeah. And I'm including the neck too, but it's
low back pain is probably some component of this happening.
Exactly.
Okay.
Most definitely.
And then let's say, we were talking about looking in the mirror or maybe a picture and you have a really big curve, basically an increased lumbar extension, or maybe someone else has recognized it, maybe your physician has. Let's say they haven't gone to a doctor yet, and they think they might have it. Maybe they're having some pain, some of that hamstring type symptoms. Where do you recommend they go? Who should they consult with?
Yeah. If you're curious about it, you're not having any, like you said, pain isn't too bad, not having any numbness or tingling. My bias obviously is starting a call with the physical therapist, just as a consultation. Hey, this is what I'm noticing. This is what I'm feeling.
Right.
What do you think of that? And is it, and I think any therapist would be happy to discuss that with you because that's what we're trained to do. Is really we're kind of musculoskeletal specialists to see that and and guide you on whether or not physical therapy would be a good option for you, and if not, help direct you to the right practitioner to kind of find out what's going on.
Perfect. And then again, Eric's company is Move Empower Concierge PT, and you can visit his link in the show notes. And I just want to thank you, Eric. Thanks for coming back for doing another episode. We're going to do part 3 soon.
Great.
Ankle distortion.
Yeah, looking forward to it.
And thank you, Founding Media, for hosting us. Thanks so much, guys. We'll see you next time.